The second major category of problems that we see that cause pain in the shoulder are problems with the joint, what most people would call arthritis. Now there are two major joints in the shoulder. The ball and socket joint is what most people think of when they think of the shoulder. The shoulder blade has kind of a cup shape to it, almost like the shape of a golf tee, and the upper end of the arm bone has a big round ball at the top, and that ball fits into that cup, and that's what makes up the ball and socket part of the shoulder. And that's what gives you most of the motion with your arm moving this way, out to the side, and up the front. As the cartilage surface in the joint can wear away, that's what we call arthritis, and that tends to cause pain, sometimes a little bit of weakness in the shoulder, and limited motion. Now, one of the things that's unique about arthritis is that the pain that you get can be very similar whether you're moving the arm yourself, what we call active motion, where you're using your own muscles to move the arm, or if something else is moving your arm for you. That can be another person, or you can use some sort of external piece of equipment to move your arm. That's what we call passive motion. In physical therapy, we use a tool like this, which is an exercise bar, and we use that to help people move different body parts. So you could hold on to it like this, and even without using your left shoulder at all, you can push with the right arm and you can make the arm move. You don't need something special like this necessarily. You can use a broom handle or a mop or a cane, anything that's rigid that you can use your other arm to push with. That'll create what we call passive motion, and if that hurts just as much as this, then that would suggest the problem is in the joint itself, and that's more likely to be something like arthritis. Now, there is another joint in the shoulder, what we call the AC joint, which is where the collarbone connects to the top part of your shoulder blade. You can find that joint if you put your fingers up here on your collarbone and kind of walk your way out, and there's a little soft spot right up here, and that's the AC joint. You can press on that area, and if it's very tender, that would suggest that there's a lot of inflammation in the AC joint, maybe arthritis. The other way you can test that is to compress that joint. The AC joint really doesn't move all that much when you move your arm around this way, but you can compress it by raising your arm up and bringing your arm across your body. Now you have to kind of go slow when you test this, because when you raise your arm up this way, if that already hurts, then it's probably not just your AC joint. There may be something else causing the pain. But if you can get your arm up this way, and then you come across and that's when the pain gets bad, that would suggest that the AC joint is part of the problem.